This is my clinical fall semester reflection of my goals, both academic and clinical. I think most of my goals were pretty attainable this semester, so I was pretty happy with my accomplishments. The first was to sort of use my practice-based research proposal from the last semester, which I didn't actually end up doing as my PBR project, but I did it just because it needs to be adapted into my clinical practice on a regular basis anyway, was to take information gained from the oswestry and guide treatment decisions with patients with low back pain. I had not as many patients with low back pain this year as I did last year. I think last year was like 62% of my patients. This year was just around 40. But I really wanted to be better at taking the outcomes that I collect and not letting them just hang out in sportswear just for the sake of collecting the outcome. I wanted to truly look at the outcome, think about the outcome, talk with my patients about what their score meant, and use the data to guide the next treatment decision. So I feel like last year I had a really good understanding of what they were, but this year I wanted to actually use them in real time to make solid decisions. So I do have a pretty solid amount of data on that project, and I think it was successful because I was really passionate about learning how to take the next step with patient outcomes. My second goal was to build a positive and helpful relationship with my mentee. My mentee was Brina, the senior student with volleyball, and we developed a pretty good relationship throughout the semester. It was definitely frustrating, and there were some barriers and obstacles for us both. I thought that we had a pretty solid plan of where we both wanted Brina to go and what her goals were. And then halfway through the semester, she actually decided that she wanted to go to medical school. So that kind of made me take a 180, and I had to continue to be her mentor, but do some research as to how I could help her beyond that of a graduate program in athletic training. I think that was accomplished because Brina was pretty dedicated and she wanted the help, so it was easy to give her the help through those meetings. My third goal was to complete a publishable advocacy project in collaboration with Ashley and Sean. I feel pretty good about this goal so far, although that our timeline didn't really work out and we're a little bit behind on where we thought we were going to be. I think we've put a lot of work into each step of the project, so I don't think anybody's very upset that the timeline has shifted a little bit because we feel like we're doing quality work. And I do think not by the end of the semester it'll be publishable, but hopefully by the end of next semester. So this goal will definitely carry over. My fourth goal was to take what we're learning in manual, specifically the positional and myofascial release technique for the upper extremity. This goal was accomplished both because it was a homework assignment and because I obviously work with patients who are easily accessible to practice this technique. So that goal was definitely accomplished through the self-critique portion of manual therapy, which I really appreciated. My fifth goal was to submit that case study that I wrote a while ago that I presented at GLADA. I worked with a colleague to edit that, and I did get that submitted. So overall, I think academically and clinically I accomplished my goals again because they were pretty attainable through the formal assignments of this semester and also my dedication to getting them done. In terms of where I want to go for next semester, I have a couple goals set out pretty much by the months that I want to accomplish them in. I think January, basically I'll have a lot of time, I think, or more time than I did in the fall, to focus on the job search and refining my resume and tailoring my resume, my references, letters of recommendation, and cover letters to each specific job that I plan on applying to. So that January goal is really to get organized. I spoke a lot about this goal with my mentor, and we have a plan to continue our mentor-mentee relationship in the spring, do some mock interviews, and continue to network and keep her informed of the jobs that I'm applying to. For February, I talked again with my mentor about additional certifications and maybe what I could do or what I'm missing on my resume to be a bit more marketable. I am thinking about at least exploring the possibility of getting my CPR instructor certification. I've kind of been back and forth between that one and my CSCS. I think the CPR instructor certifications is a bit more realistic, taking DAT coursework and studying for the CSCS. Plus paying for the CSCS is kind of a lot for the spring semester, so definitely going to explore that at least in February. And then data collection for our advocacy project. Hopefully finishing data collection in February and writing in April. For March, data analysis, so taking all of the student athlete and athletic trainer responses and sitting down and analyzing that and trying to get Ashley, Sean, and myself some solid data so we can write 3 different papers. And then I also wanted to apply a new prevention program with volleyball in the spring, probably in March, since that's when we start individual and team practices up again. I know that we'll be taking a course with Dr. Games, and I hope to at least explore some new avenues for prevention to make the jobs of the next athletic trainer a bit more easy transition with some solid data for them. And then in April, I think my only solid goal is submit for publication for our advocacy project. So I think if I stick to the timelines, and Ashley and Sean and I all stick to the timelines that we set in the beginning of the spring semester, we'll be successful.